Well, we are lucky to have with us our residential dentist, Dr. Daniel Nickles, located right there on Pleasantburg. You join us monthly on the show. We appreciate it, and we've kind of started to call you the no-fear dentist. I like that.
It's a good thing to be called the no-fear dentist.
It is, because sometimes being at the dentist is a little scary for
nobody
some people.
wants to come see us.
Poor Dr. Nickles.
Can we all say,
we try to make it fun. I mean, we really, I feel like I'm a very lucky man because every day I have about 20 or 30 of my friends come see me.
Right.
And over the 21 years I've been in practice, and we've built a lot of great bonds. And it all comes off of just really engaging people. I mean, everybody has a story, everybody, is a person. Mm-hmm. And so, we take it beyond just taking care of your teeth into who you are, listening to you and finding out, how did you get where you are? Because we deal with people who haven't been to the dentist. You see my commercials.
We won't judge you. I like that. And
yeah. I mean, the reason I've had people, my philosophy behind that is I had people come in, the first thing they would say was, please don't fuss at me.
Oh.
I said, well, why would I fuss at you? Well, somebody else, I've been fussed at every time. I quit going. And now, I'm in a bad situation. So, we talk to them, we engage them, we listen. Right. And it's been a great thing because when you have people that you actually start trusting you change lives.
Yeah.
And that makes you feel good when somebody actually leaves with a smile.
It does, doesn't it?
Yeah.
That's right, because you think, your mouth, your teeth, that's like the first thing people see. Oh, so if you're not comfortable with it, you're just not comfortable with yourself probably, right?
Right.
How much of your clientele are children?
Probably about 25%.
Yeah.
I mean, I love children, but really, most of what I do see, the children these days, they've got it made. I mean, mom and dad, know what to do, brushing and flossing and some fluoride, and so they're almost taken care of. Most of what I do is for the people who, like I said, they've had bad experiences from the past.
Right.
They're a little bit older, and they have that work that either needs to be fixed or work from the past has got to be brought up to date.
Yeah, because I can see some people, it's like a spiral, they haven't been, well, now I'm not going to go. Well, now all of a sudden it's been 10 years. Oh, my gosh, I'm going to be, in trouble. We were talking earlier that summer seems to be a big time for you. It's starting to wind down now.
Starting to wind down. School is coming back. You start seeing, you have that when the children get out of school, the teenagers are coming in, they're getting their wisdom teeth out, and that's, probably summer and Christmas is a big wisdom teeth time.
Right.
But this is the kind of time when the children start going back to school, and, it's a good time for, if you haven't been in a while, is to, as we get back into the routine, get those appointments set back up and, get everything, set. Because summer, everything kind of gets, lost in the shuffle.
Yeah.
And so when school starts back, the routines start back.
Now, only smart kids have wisdom teeth. Is that how that works? But why do we have those? Nobody needs them, right? You know what? It's like, I don't know why. It's one of those things that I appreciate it. It puts money in my pocket.
Yeah, thank you.
Well, the ones way back there, right?
It's the way back there teeth. Yeah. And, between 16 and 18 years old is about the best time to get them out. The worst thing you could ever do is not get a wisdom tooth out that needs to come out, especially if they're impacted. If they're in the jaw and they do not erupt, they sit in like a little sack of, soft tissue.
Right.
And if they sit there over time, you don't have them extracted when you get, 30, 40, 50 years old. I have had I get probably one a week where somebody never got their wisdom teeth out. The dentist said, heck, if it doesn't bother you, don't worry about it. Well, they sit there over time and they don't erupt, and there's a little sack of cells start forming cysts and tumors. Jeez. And I have one a week where somebody will come in, they've got a cyst and tumor in their jaw. We don't heal as well as we get older, and it becomes a big deal. So, hey, when you're 16 and 18, you're young, you rebound fast.
Enjoy the 2 days of just laying in bed and hanging out.
But some people don't get them, right?
Some people don't get them. I've had some people that I have, they'll have 2, they'll have 3. I had a child that came in recently, has 6 wisdom teeth.
Oh, he's really smart.
They have 4 wisdom teeth and then 2 extra on the top.
Yeah, he made $1,300 on
that. Show off, yeah, show off.
That's why.
Now, what if I haven't been in a while and I want to make a good impression? Can I brush 8 times a day? Does that make a difference before I come in, or does it?
Oh, I love to see that. You'll see people that haven't flossed in a while, and the day they
all
show
of a sudden,
up, their gums are beat all to pieces. And I was like, what happened? Well, I haven't been, so I decided I'd start flossing last night.
Last week's been a little rough, yeah.
Just come in. We see it every day. I haven't been surprised in years. Just make the appointment, come in. We'll get you started off, on a good ground level. We'll make a plan for you.
Yeah, maybe that can be our new challenge for you. Let's see your biggest surprise that we can present.
Try to surprise Dr. Nickles.
Exactly.
Well, our tease, Dan, before we came in with you, was medication. Dries your mouth out. Is there something we can do about that?
There's a lot of medications these days between antidepressants, anti-anxieties, antihistamines that are really drying people's mouths out. And your saliva is there to coat your teeth, to keep your mouth, your teeth lubricated to your tongue and the food flows over it, but it also acts as calcium. The calcium in it to recalcify your teeth.
Mm-hmm.
When you take that away, your teeth aren't being calcified. So, we start having to fight these things with some new material called MI paste, fluorides, and actually artificial saliva is a big thing called biotine. Is a material that we kind of, have for our patients because it's become an epidemic, and these people start developing rapid decay, especially around the root and the gums.
Wow.
So, yeah.
I see that guy advertise that on TV. Do you have, and he doesn't say mouth right, he said, do you have dry mouth? I just want to slap him and say, where are you from?
Mouth. Yeah.
Mouth?
Not from around here.
Eastern Virginia. Mouth?
There you go.
Canada.
I would say, yeah, he's Canadian, obviously. Well, Dr. Nickles, thank you so much. And you're fun, you're laid back. You'd be a good one to go to the dentist with. So if you haven't been, go check him out. He's on Pleasantburg. The number has been on the screen. Give you a call. You got your ladies standing by,
Yeah,
right?
they're standing by, waiting for you to call.
Yeah, Lake Forest Shopping Center.
Lake Forest Shopping Center.
On Pleasantburg.
Perfect.
Thanks, Dan.
Thank you.
Hey, the deal of the day, right?
Right.
We got that? Well, it's the biggie from Smithfield Country Club for...
7.
Shouldn't say that when I play golf. 7. But anyway, a round of golf for $20. That's right. With all the amenities, and that's the deal. There are only 125 of these available. You have to go to YourCarolina.tv, take a look at the banner on the right side, and buy it because it's worth, it's worth more than that, obviously, so it's a bargain. It is our deal of the day from Smithfield Country Club.
That's like a great place to go cool off, have fun. Thank you, Smithfields, for being a part of it.